first I would verify the physician's orders, and then I would gather my supplies. And I'd come into the room, knock, knock. Hi, my name is Emily, and I'll be your nurse today. We will be inserting a catheter. Can you verify your name and date of birth for me? And I could check on the wristband as well. And then I would ask if they have an allergy to betadine or latex, and she does have a allergy to betadine, so we will not be using that on her today. And then I would provide privacy. I would wash my hands, and I would put on clean gloves. Lift her gown up and then place her in a dorsal recumbent position. And then we would inspect her and clean her as needed. And then we would inspect for the meatus. And then once we do that, we'll take our gloves off, wash our hands, and then we're ready to get our supplies. So I would open this up. We would place this between her legs. And then I would use this for trash at the end of the bed. And then only touching the 1-inch border, we would open this up. And then we can place the other pad down. You put it down the other way. And then we would ask the patient to lift their hips up, and we would slide it under her some more. And then now I am ready for my gloves, which these were on top before I'd open the package.
He was ready to pick up the cap.
I literally every time. I like to put it on. And once I have my sterile gloves on, we can start arranging our supplies. And then since we cannot use the iodine on her, I'll be using simulated swab sticks. We also cannot use the lube on her. And then normally I would open up the packet of lube and I would put the catheter in the lube, and then I would set it in the tray. And while that's sitting in the lube, I would get my syringe and attach that. Noting how much is in the syringe so we can document that later for how much we put in the balloon. Then I would have my lovely assistant hold my iodine cleaning swabs. So once all of my supplies are ready, then we will go ahead and clean her up. We would kind of hold her open. And now that my hand is contaminated, I cannot take it off of there, so I will take one swab stick and clean the far labia from top to bottom. And trash that. And we'll take a second one. And the closest top to bottom. And then one above the meatus to down below. Now that she's clean, we cannot let go. And then my lovely assistant will spray for me since we cannot use the lube. Thank you. And I will take my catheter and insert it, making sure I do not touch her. And you know to go until you get some urinary backflow. She is resisting. I don't think she will go anymore, but we have not gotten any urinary. But normally there would, and we would document what it looks like and the color of it. And then we would inflate the balloon, but we cannot do that on this patient. So we will just pretend we are. And then once we do that, we would gently tug to make sure that it's not going to come out. And then now that that is done, I can take my hand off of her, and then I would take the syringe off and discard that. And then we can rip this off of her. That's why I verbalized to you. We could trash that. So I can take this. I would trash that as well, and then we can tape her. Always hold my hand like that. Maybe. Once we tape the tube to her, we'll place it on a stable part of the bed. And then I will clean her up, wiping off all the lube. The tape would hold. And then we would clean up our supplies. And all of this will be trash. Take my gloves off. Thanks. When I would wash my hands, I would put the patient back. I would make sure she is comfortable and put the bed in the lowest position, and then I would wash my hands, make sure she has the call light, and then I would go document. And then we have to take out the catheter. So I would verify the physician's orders. I would gather my supplies, what I needed. I would come in, introduce myself. Hi, my name is Emily and I'll be your nurse today, and we'll be taking out your catheter today. Can you verify your name and date of birth for me? Okay. And I would provide privacy. I would wash my hands. And I would put my clean gloves on.
They say good stuff.
And then I could put a disposable chuck underneath her just in case. But the first thing I would do is check the urine in the bag, measure it, how much it is, what the color looks like, the clarity. And we would untape this. And this would be empty. And then I would need to get my syringe and attach it. And then we would take out everything that was in the balloon. And that would be trash. And once we are ready, I will tell her to take a deep breath, and then we will pull out pretty quickly. And take all this. And this would be trash. And I would take my clean washcloth and I would wipe her up. Put her back in her position. And then I would cover her back up. But after I clean her up, I would take my gloves off first since they are dirty. I would wash my hands and then I would pull her covers up. And then put the bed in the lowest position. Ask her if she needs anything. Place the call light to where they can get to. And then I'd wash my hands and I would go document.